Postural orthostatic tachycardia syndrome. What we are going to discuss is what exactly is this? How would you test for it? And how does that impact the care that you should be receiving? So we're going to dive right into postural orthostatic tachycardia syndrome. And thank you for joining me. So the very first thing, whenever someone thinks they may have postural orthostatic tachycardia syndrome, which we'll call it POTS, because that's what most people know it as, okay? You have to say, do you even meet the proper criteria to be diagnosed? Because everyone wants to know what the evaluation is. But there are things that should be done to lead up to the evaluation. So some of these are questions, some of these are symptoms, and then yes, part of the evaluation is also testing. So what are some of the key things though that we should see with POTS? Well, if you're an adult, you should see a change in your heart rate of greater than 30 beats per minute when you go from laying or sitting to standing. Now, this should occur within 10 minutes of standing up. Now, if you're an adolescent, so 18 years or younger, we're actually looking for this to go up 40 beats per minute. Now, there are some thoughts that even having sustained heart rates greater than 120 may be criteria, but it's not universally accepted quite yet. Now, the other thing, while you should have increased heart rate, you should not have a significant drop in your blood pressure when you go from sitting, laying to a standing position. So what does significant mean? Well, it's a change of 20 in the high number or 10 in the low number, greater than either of those. So let's say your laying down blood pressure is 120 over 80. Well, if you drop to 96 over 80, that is considered a bigger drop than it should be. Or you could be 110, but then that bottom number drops more than it should be, right? A lot of people, it's going to be both. So those will drop. Now, if those drop, you do not meet criteria for POTS. That is something else, orthostatic intolerance, which we'll save that for another time. Next, you must have had these symptoms for at least 6 months. Maybe this will change in the future, but presently you need to have had your symptoms for at least 6 months. Okay. This cannot be something you've had for a few days or a week or two. If you get diagnosed and you've only had it that long, then that'd be an improper diagnosis. Now, lastly, when we look at anything in the world of healthcare, it's important that we realize that other causes that could create these symptoms have been ruled out. Now, you may be wondering, well, what are the symptoms someone could have if they were worried they had POTS? Well, lightheaded, they often feel faint, dizzy, heart palpitations because their heart's just chugging along, especially when they go from laying to standing or sitting to standing. They're usually tired. Usually some of the simple things just wear them out. They'll often notice visual changes. Their vision just doesn't seem right. They'll go to an eye doctor. They've got fuzzy, blurry vision. They'll often have nausea, near fainting. So they feel if they don't go and sit down or lay down that they're going to pass out. Now, there are those that are really bad where they will pass out as a result, but near fainting is enough. Headaches, anxiety, and there's even more. Now, the hard part when we look at what should not be there beforehand, that could cause it is anxiety can cause a lot of the symptoms of POTS, but POTS also can cause anxiety. So we really make sure we're attributing the right thing to what. So when we look at POTS, there are different types of POTS. Now we're going to break this down and we're going to say neurological POTS. Okay, so that's a neuropathic. We're going to say cardiovascular POTS. So that's hypovolemic. We're going to say immune system POTS, mast cell, and then we've got autoimmunity. Okay, so we're going to lump those two together for the purpose of this. And then we're going to have norepinephrine based POTS issues. Okay, not as common in my experience. And I see mostly the neurological and the immune system mediated POTS. So that's the lens we're going to take with this. Now, you may be wondering, who am I? Well, I'm Dr. Spencer Zimmerman. I'm licensed as both a doctor of chiropractic with a diplomate in chiropractic neurology, as well as a family nurse practitioner. And I've been helping people with brain-based issues for over a decade now. And I've learned a lot along the way, and I'm sharing this with you because I do see a lot of patients who are struggling with POTS, and they've done everything that they've been told up front. Normally, the treatment for POTS for most people is compression stockings, increase your salt intake. If your heart rate's going crazy, they'll get put on a beta blocker or something else like that. Now, I get those who are not getting better. So I'm not going to spend a lot of time on the hypovolemic because a lot of those people end up at cardiology and they can do well with that. Whereas I see the people who tend to have the neurological as well as the immune system based POTS. So now we've talked about the symptoms that someone can have with POTS. Next, we are going to explore what are some of the things that can set people up to get POTS in the first place, because POTS has been increasing in popularity. So as we've talked about, right, there's primary POTS, there's secondary POTS, which we've already said, mast cell related issues. Diabetes, infections can cause it. So there's been a lot of issues with COVID where those individuals end up with POTS. We have associated things. So these are people who are set up for POTS. So Ehlers-Danlos syndrome, chronic fatigue syndrome, brain injuries, okay, concussions, TBIs, as well as migraines. Now, when we look at Ehlers-Danlos syndrome, basically, if you're not familiar with what that is, these people, they tend to have a lot of gut issues. They also have hyperflexibility. So they'll do things with their joints, like their elbows, their fingers. It's like, that's not really normal. They're prone to dislocation. They can be prone to spraining an ankle, hyperextending something. Okay. So that's what that looks like. Now, it's important to remember that there are things that can be associated and you do not have to be one. And that's one of the big things that I see is people, they get kind of put into this little box and they're like, oh, well, that's the one I've got. And it's like, well, is it really the one you've got? And that's what we are going to keep talking about. Now, females are definitely much more likely to end up with POTS. That's nearly 80% are going to be females. Okay. So it's females way more. I've seen it in teenagers and I've seen it in adults. It kind of hits the full spectrum. So no one's necessarily immune from it on the female side. What should we actually be asking people who have POTS or we're suspecting them to have POTS? Now, I do want to make a notice that dysautonomia, lots of people are like, well, I've got dysautonomia or I've got POTS. Well, dysautonomia is an umbrella term. POTS is a specific type of dysautonomia. So if you did not have the criteria up front and you did not have POTS, you can have dysautonomia. Now, I personally see that these individuals are able to be treated fairly similarly and get good outcomes when we see these things that I'm going to show you. But the first thing is all about detective work, finding the clues. Everything in healthcare is about pattern recognition. So I often ask people, what are 5 things that make you feel better or worse? List them. And list them in the importance of how they impact you. Because based upon that, that's going to give us clues of where we should focus on, right? What happens when you get stressed? Does it change how you feel? What about sleep? What if you lose an hour of sleep? What about food you're eating? What about menstrual cycle issues? What about visual stimulation? What about cognitive challenges? You're at work. What about driving, taking all this visual input? And are you getting sick frequently? Or if you get sick, does it take you longer to recover than it should? And if you get sick, does it tend to flare up your symptoms and then it lingers beyond the time you're actually sick? Based upon how you answer those questions, it starts shifting in my mind. Which type are you, right? Up front, in my mind, right? Cardiology's already done their workup. I'm going at it. You're 50% neuro, you're 50% immune system based. And these questions start shifting it. So if menstrual cycle flares you up, if stress flares you up, you're getting sick frequently, then that shift, make me think, well, maybe there's a good bit of immune system related issues versus, hey, when I'm in a car, man, that's just really rough on me. When I've got to concentrate, I'm at a grocery store, that's really rough. Now that's more neurological based. Now, once again, you can have different ratios. Some people are 50-50, some are 90-10, but it's about what's making you tick. And then we also have to realize, well, if menstrual cycle's off, once again, we've got to make sure there's nothing pre-existing. What's your iron look like, right? Do you have anemia? So when we look at this initial workup for POTS, what does it even look like? Well, as we said with the criteria of being diagnosed, your heart rate has to go up and your blood pressure should stay fairly good. So we should be measuring this with you laying down, sitting, and standing. Now, some clinics and even cardiology, right, they're using tilt tables. So tilt table, basically table you lay like this, right? They can elevate you, and sometimes they've got blood pressure cuffs hooked up to you the whole time. But something should be done where they're looking at those vitals because, as we've talked about, if they change in a way that doesn't fit criteria for POTS, you do not have POTS. So we want to make sure this is done right. And then, like we said, make sure you don't have other things, right? If you have thyroid issues, specifically increased thyroid hormone production, that can create a lot of the issues. If you have iron deficiency and you have anemia, that can create many of the issues. And there's other things beyond that. So getting a well-rounded evaluation and workup is key to getting better. So this is what it looks like initially. Now, most people I see, they've had this done to an extent. There are those who come in and they've been told they likely have POTS and they've not had blood pressure, heart rate done, and they have not had a lot of labs. That does occur because the training on POTS is really catching up. It wasn't truly accepted until COVID. Yes, I know there are people who were diagnosed with it a decade ago, but it wasn't really an official diagnosis. Okay. So because of that, it's now getting more and more accepted. When we look at POTS, as I've said, most of the people I've experienced with, it's neurological or it's immune system. So how would we even evaluate the nervous system? Some people are thinking MRI, CT scans. Well, for POTS, these usually aren't of great value. And most of the time we get nothing from it. It's not a good use of money. So balance, eyes, and brain waves can be critical in seeing how the brain's functioning because this is about clues and pattern recognition. The more off this testing is, the more symptoms it causes, the greater the likelihood when we treat it, you are going to feel better. Versus if you ace it, it doesn't make you feel anything, then that wouldn't be the right approach for you because there is no magic bullet for POTS. There's not one treatment that works for everyone. So having a good workup can help know which path you need to be on. So balance testing. So what does balance testing look like? This is someone who did initial testing and then post-treatment testing. The higher the number, the more movement they had when we performed this test. Now, this was done using a computerized software where they would stand on a platform and recorded how much they moved over a certain time span with eyes open, eyes closed on a firm surface, and then again on a perturbed surface, so a balance pad. And this person moved way more than they thought they would. And guess what? Once we got them treated, they did a lot better. Now, this test alone for POTS and other dysautonomias can be a little bit tricky because you do have fatigue and muscle weakness with POTS. And sometimes people, their balance is really a reflection of that fatigue and being tired and weak. So I don't put all my stock only in balance testing. Okay, it's important, but I like seeing other things to make it more predictable versus a concussion. Balance testing on its own does mean a lot more because you tend to not have the same muscle fatigue and feeling like you're going to faint. Now, eye movements are one of the best windows into the health of the brain. So this is what it looks like, right? Someone's wearing those goggles, and this is me reviewing results, but they're ultimately performing a variety of tasks. So we do a big assessment over 30 points. Okay, I'm going to show you a few of them, what it looks like. So this very first one is someone who's looking straight ahead. The dot jumps to the left, and they should be keeping their eyes still on the target. And what you'll notice is their eyes are not still one bit, okay? Their eyes are shifting left and right like crazy. So that's what abnormal looks like. Now, I did want to show you one that's pretty normal. So this is someone, and they're just looking straight ahead. You'll notice that their eyes really aren't moving left and right much. Okay, maybe a little bit. Yes, their pupils do go in and out a little bit, but nothing overly significant on this where I'm saying, hey, that really fits into my predictable pattern of results. Because the more predictable it is, the greater the likelihood someone's going to get better. The less predictable, because you have to do a little bit of a stretch, it doesn't mean someone may not respond to care, but it means they're not as likely, right? So this is someone, they're tracking left and right. The dots moving nice and smooth left and right. Their eyes should be moving nice and smooth left and right. And what you'll see is this is anything but nice and smooth. Now, what I've seen over my 10 years of experience of helping people with a wide range of neurological symptoms and conditions is that when the eyes are off and it creates symptoms, they usually have fatigue, brain fog, headaches, neck pain, word finding, memory. Now, they may also have anxiety issues, they may have neck issues, and more. But the eye movement test is something that's so important for people to get done. But well over 95%, probably closer to 99% of the people I see, they've never actually had a full eye movement assessment. At best, they get kind of a brief little screen that's like, follow my finger. Honestly, I don't consider those the most valid. You don't remember what you truly saw. Everyone's going to document it a little bit differently. So we've got the technology to use computers to record everything. That's the highest standard, and that's what we do. Next, tracking up and down. So the dots moving up and down nice and smooth. So are they moving up and down nice and smooth? Or are they, going zigzag? Are they skipping? What you'll see is there's a lot of zigzag, okay? And there's even skipping. So whenever I see these patterns, someone's got symptoms of POTS, I strongly start thinking, hey, there's a good degree of neurological issues that when we get this addressed, they should be feeling better. And in my experience, 90% are going to be feeling a lot better as we address that. Now, one of the other things you can look at is brain waves. So this is done using what's called a QEEG, quantitative electroencephalogram. Most people think about brain waves and wearing the caps for epilepsy or seizures. This is a way to use it beyond that. Okay, so it runs through a computerized system that analyzes it, and you can see different patterns. So you can see things for focus and concentration, or ADHD, depression, anxiety, and other things like that. Because as we said, if someone has anxiety, they can be more likely to have POTS-like symptoms because anxiety is the issue, or their anxiety is from POTS, or maybe it's a mix, right? It doesn't have to be all one or the other. So this is the neurological assessment for POTS. Now, as I said, there's two sides that I see a lot. There's the neurological, and then there's the immune. And as we talked up front, the immune was really broken down into mast cell activation syndrome, as well as autoimmunity. So one of the big things that I see is a issue for people with many of the same symptoms we talked about. They also didn't have some nerve-like issues, numbness, tingling, shooting pain. And that's with mold-related issues. Okay, mold is a growing issue. Just like how allergies of any type, we've got more food allergies, we've got more seasonal allergies than we've ever had. And mold is the same. So this is one of the tests I do. I don't do it on everyone, but there are individuals who, based upon their history and their examination findings, this test is important. This test is broken down in two parts. Is we look at more of an allergic response to mold. And then the other one is we're looking at prior exposure to mold, which may also mean an ongoing immune response. So if that's something, we have to take care of that. And if I suspect mold and I see bad neuro issues, I usually will not treat their neuro issues up front, because there are those with mold issues who they just will not respond on the neurological side until you treat their mold. Okay. Now, there are those who are okay feeling 20, 30% better. And so it's worth doing the brain-based treatment to improve the neurological side while you are going down the journey of mold. So this is one thing to really consider. Now, the next thing is to look at this test. Okay. So this is called a lymphocyte map. This is a specialized test. So whenever you normally get a blood test, right, you get your white blood cells and you get your lymphocytes. But lymphocytes can then be broken down into all of these things you see here. And based upon what we see with this, it may steer us in a different direction. So for some people, it's led me to be like, hey, you've got mold issues. For others, it's a urinating super inflammatory state. For others, it looks like you're trying to fight an infection or there's something that maybe needs to be killed. And so this is another way to get more clues because this is detective work. The more things that we have that we've been able to identify, the more likelihood we can help you. Versus if we only look at one thing, we now have to make that thing so much more than it should be. And that's why I see so many people struggle to get better is they've been to so many different providers and each provider finds the part that they really like. But because they only focus on one thing, there's a missing link. And that's what we help people find is that missing link. So here's just the rest of what that test looks like. So remember, POTS can be more than one thing, even though they show immune system, neurological, cardiovascular. You don't have to be just one type. You can be mast cell plus neurological. Oh, but you could also be mast cell plus concussion plus migraine POTS or throw in Ehlers-Danlos in that. And this is, once again, I can't stress how important it is. And this is why when someone comes in, we spend so much time with them on their initial evaluation and with the initial paperwork that we're having them do, because the more things that we can get answered, the more pieces of the puzzle that we can connect, the greater the likelihood we can help someone up front versus them struggling. So this is what I want you to know about a POTS evaluation and what should be considered. Once again, it's not just all about testing, but it's about the questions that should be asked.